Tropical Africa, commonly known as the Great Lakes region, or more so, East and Central Africa, is highly crippled by endemic poverty and transboundary diseases resulting from lack of knowledge, skills, and technology that could lead communities therein to the next levels of development. Key sectors to improve the Great Lakes region's development have been identified in industrial technology, agriculture, tourism, higher education, and most importantly, the animal resources as a strategic pathway for poverty reduction in East and Central Africa. With the concerns from Makerere University as the lead African institution and Dakota State University as the lead United States institution, and for the 11 higher education institutions and partners from the US, Uganda, Tanzania, Kenya, Rwanda, Burundi, Ethiopia, and Somalia are planning together with their respective ministries of agriculture, animal industries, and fisheries to forge practical solutions towards health and poverty eradication in the East and Central African region.
Our strategic direction is to be a leader in the region in a number of dimensions of the animal industry, including animal welfare. We would like to launch into research. We would like to launch curricula that are appropriate and redesigned to be sensitive to the issues that impact our animal industry. And welfare is one key issue.
But the objective of this is to train a group of people who can bring the synergy, come together and try to build on that knowledge in a systematic manner.
The benefit will be there, but we must involve other stakeholders. So we need to involve academia or the academicians in training institutions. We need to involve the people working on business. We need to involve policymakers and so on.
The emphasis returns to animal resources as the best strategy for poverty reduction, but which strategy is also faced with challenges of transboundary diseases that need to be urgently addressed in order to control their spreading within the region like a wildfire.
Sick people are keeping animals, and they are also living with animals. People are going to the park and the animals are going to the park. We need to understand the patterns there. Who is at risk and so on. So, if TB is on the increase here, is it just because of HIV or are our animals and other factors playing a role? Can we have new ways of detecting it and monitoring it?
How can we demonstrate to the world that by jointly working on livestock and wildlife, you'll actually be solving human problem, but also creating economic opportunities.
We give this knowledge about the patterns of this disease, detecting it and so on, and how to diagnose and treat based on research that we will undertake. Then you are able to advise government on how to implement policy better, on how to ensure food safety, on how to ensure inspection of meat, on how to control the consumption of wild meat, and which groups are at risk. I mean, you have, for example, animals sometimes share the same water source with humans. How much TB is spread at such a place? Research has to be done so that we advise people. And I must add that in Africa, all these diseases are largely endemic.
On the other hand, East and Central Africa is equally faced with endemic and emerging diseases like tuberculosis, Ebola, Marburg, brucellosis, sleeping sickness, foot and mouth disease, and the Rift Valley fever, all of which are perpetuated by human interaction with animals in form of cocktail residential sharing, inadequate urban livestock management, wildlife delicacies, and most worsened by the prevailing climate change.
These people have become more poor. They are even unable to send their children now to school. They can't afford 2 meals in a day. Just as a result of that, and I think they continue to suffer as a result of the climatic changes which impact on the animals. They are supposed to have the animals multiply in numbers when there are good times. And when the drought comes, they sell these animals. But unfortunately, these animals now, as they die, they are not being replenished easily. So they get less food. Unfortunately, one of those animals in that regard, which were being used as a kind of a current account, were the goats and sheep. But there is also a disease which came, a very bad disease which, if we allow it to go down south, it will be very difficult for the country to eradicate. And a quarantine has been put in place here. So they are not selling these small ruminants. So that has also impacted on them. And it is also as a result of these climatic changes that these diseases have come in here. Because they were diseases of the dry areas of southern Sudan and northern Kenya.
Climate change has played a major role in the spreading of tropical diseases, which affect both human and animals.
How we cope up with this change is normally not really adequate, given reason that we have most numbers of people living under poverty, and then you find that we don't have immediate response to address some of these issues, and that's why it is a global concern.
The Africa-US Integrated Diseases Management Network is therefore focused on national and regional development efforts aimed at poverty eradication and better livelihoods that include food and nutrition security, public health and wealth creation, sustainable exploitation of domestic and international markets, enhancement of youth and women production by participation into economic engagement activities. The partnership further looks at institutional and human resource capacity development, as well as the most important aspect to develop innovative solutions to health and disease and create entrepreneurial generations through high institutions of learning.
To do either teaching or research. To experience the different environment and problems is very commendable, especially if you are also training students.
But those which could spread, like avian influenza, has been a big issue. Some of the diseases which are coming out of the wild populations in Central Africa particularly, but also in Asia and elsewhere. And with international transportation, with the movement of people and animal products, the potential for those to spread around the world so fast is such that if we don't have people around the world aware of these, they won't be there to recognize them and to deal with them when they occur.
The 21st century Africa has an estimated 224 million cattle and 447 million goats, with an estimated 34 million equines and camels, which figures represent over 60% of animals in Eastern Central Africa. The annual revenue for milk in Eastern Central Africa currently stands at $13 billion, while that from beef stands at $5 billion, which figures are likely to drop because of escalating public health and economic animal diseases, droughts, and climate change extremes. Livestock provides 36% of Africa's gross domestic product. In the East and Central Africa, animal resources contributions range between 35 to 90% of the gross domestic product, with Ethiopia, Somalia, Sudan, and Kenya taking the lead proportion of about 50 to 90%. However, Uganda's animal resources contribute 35 to 40% of the country's gross domestic product, representing 67% of the household income.
Globally, clients and the global economy are not interested in poor quality animal products. The way you handle your animal, the way you feed it, the way you care for it affects the quality of the products. And if you produce an animal with poor quality, you will not be competitive in the market. You would wish to know, for example, that because of poor animal handling and care, and the constraints that we have in an animal welfare system in Africa, Africa's share in the global market has dropped from 5% in 1991 when the World Trade Organization agreements were initiated in Uruguay, and now we are talking of less than 2%, and this percentage is dropping because of poor standards of hygiene and poor welfare, among other factors.
Communities are the primary victims of the growing burden of transboundary diseases and zoonoses in East and Central Africa. The burden is particularly grave among poor and the underrepresented groups such as women and people living with HIV and AIDS. The negative impacts of transboundary diseases and zoonoses are heightened by proximity to diverse livestock ecosystems. It's been established that loss of animals and productive human life through disease escalates food insecurity, social stress, and poverty.
In the last 20 years, it has shown that 75% of the diseases affecting humans actually come from animals. So there's it shows that there's a trend now, an increasing trend of animal diseases affecting humans. Therefore, it means that we who are veterinarians must make sure that the animals are healthy so that they don't transmit diseases to humans.
SARS, for example, in humans was one. AIDS is actually one. HIV came out of the animal population into humans and spread. Foot and mouth disease is a big worry for those countries which don't have it anymore because it's very common in some other countries. So there are multiple examples where we can be.
It is in this view that high education institution research also plays significant major roles in generating knowledge, information, and technology. Much as universities in the United States have strong extension knowledge and technology transfer systems, such as land-grant systems, in East and Central Africa, such systems are either weak or non-existent. The 5-year Africa-US partnership is therefore to network for the transformation of higher education consortium to culminate and achieve excellency in integrated diseases management and socio-economic development within the East and Central African region. Compiled and presented by Hans Chaze for the Africa-US Integrated Disease Management Network for Higher Education Institutions and NGOs.